information. When I got the information from our epidemiologist, I asked her if she was sure because I'd actually been at the hospital yesterday morning for a tour to see their facilities. To They had done some expansion of their facilities, and I had wanted to ensure that what was coming, where it would be, etc., etc. And then later in the afternoon, I also saw Dr. Holiday at the airport. So he had told me that another person had passed, and apparently one had passed during the night. So that is what brought up the numbers to 6. So yeah, so basically it's 6 now, and we have 37 positives. As you know, we have started doing more testing. We have the ability to test on island now, so you can also get faster results. And we had a long snag over the weekend last week, which seemed as if there were no increases, but it is just that the results took a long time to come in.
Okay, Madam Prime Minister, the two persons who passed, was this at the hospital?
Yes.
Or at home?
Yes, at the hospital. At the hospital. The hospital had 6 patients up to yesterday, and before the 2 passed, and then they were in critical condition. I remember when I updated the last time, I had mentioned that they had 2 critical and 1 stable, and the both critical patients passed away. So I'd like to, at this time,
male or female?
I don't have that detail at the moment, but I would like to convey the condolences of the entire government and the EOC to the families of the deceased. What we are seeing, Grace, is that especially those that have gone directly to hospital and who are not on our tracing list, persons are waiting until it is too late. Persons have underlying morbidities, meaning they have either diabetes, high blood pressure, obesity, some type of lung disease already prior to getting ill, and are not notifying CPS or their general practitioners, their house doctor, in time. And so by the time they get to the hospital, they are in such a bad state that it is difficult to even intubate them and put them on the ICU, because the ICU actually shuts down all the other organs. And if those organs aren't functioning optimally, then the person will die even quicker. So
at what point then should they be going to the hospital?
Persons who are feeling ill should call their doctors firstly and let the doctors ascertain whether it is a case for the emergency room. And once it is, then the doctors will call ahead, or the patient themselves, but more than likely it's the doctor that will call ahead, and then they will then be able to receive them at the medical center. The problem with going to the medical center without calling is that they're not prepared, because there's a special section for possible suspected cases of COVID-19, so that it does not contaminate the rest of the hospital.
Okay. Now, the KDC-10 of Netherlands Air Force aircraft landed here yesterday. Were you at the airport?
Yes. And it took quite some discussions with our Dutch Kingdom partners in our Vierlanden overleggen over the past few weeks. We have been highlighting our concerns with not having enough capacity should an outbreak occur. This was since the 3rd or 5th of March. We have been busy with the requests. And the following last week, I must say, thanks to the intervention of Curacao and St. Eustatius, when we were in our 4-country discussions, consultations, including the best islands, when it had been finally decided that we would get 6 beds out of the 42. That is the first tranche that Curacao and Statia, seeing that we also supply the overflow for Station Sabre, mentioned or pushed also that we get more than the 6 beds. And though all 12 beds were not on the plane yesterday, the 12 IC units did arrive, and 6 beds with all the medication and equipment needed to be able to run them. As of now, though, we have no one in the ICU. Well, as far as I know, let me say, I wasn't updated on that part. So far, the 4 that were in hospital yesterday as of 3-4 p.m. when we were being updated is only 1 was a confirmed positive, and 3 were suspected cases awaiting awaiting test results. So if the test results go in after 3 p.m., they will get the results this morning. So I'm sure I'll be updated on whether those 3 are also positive cases. So 4 in hospital right now, and I don't have it up in front of me, but we are monitoring isolated cases. We are testing heavily now, almost 20 per day. So I can expect that with our criteria for testing that we would have more positive results out of what we test, because we're not testing random persons without symptoms.
With these medical supplies that just arrived yesterday, that we just received yesterday, will this also include additional help, meaning in the sense of
Human
medical
resources?
staff flying
Yes.
in from the Netherlands?
No, not from the Netherlands at the moment. The Netherlands were able to collaborate with a group of medical technicians and personnel in the United States. They have all tested negative, and they will be arriving on island to work within this new section of the hospital, because we are setting up another tent. So a military tent that is called a hospitainer is being set up on the tennis courts right opposite the hospital and next to the pavilion that we are working on for the medium care persons. This hospitainer will hold the 6 IC beds. There's a whole lot of logistics involved in that, and that will be set up over the next 2 days in terms of getting the electricity on the proper, I think 50 hertz is what I heard the technician saying at the location yesterday. Mr. Janssen of GEBE is the person directly working with the hospital. I must say the machinery behind of the ESFs are working diligently, and I'm super, super proud to be a part of this organization. Despite everything that is being said, it requires a whole lot of persons involved, and the professionals are logistically handling, together with the Marines, the setup of this hospitainer during the course of today and tomorrow. And then on the 7th and the 8th, the medical personnel will arrive. We have already organized for where they will be staying, and the logistics as to ensure that they are taken care of is also being regulated by CPS.
The concern about the medical files or basically, let's speak about confidentiality amongst persons in the health sector.
Yes.
You briefly mentioned
the oath that they swore. We try to ensure that only persons who have sworn the oath, are the ones privy to confidential information. Everybody in the EOC, even though, for instance, GEBE and BTP, being outside government entities, harbor and airport as well. These are people that we expect to be of high integrity levels. All our other EOC members are government employees and or consultants, and I really don't know. I don't think it is done with malintent, but I think persons who do that miss the boat in terms of understanding how detrimental it can be, the panic it can cause, etc. I have a map with all of the information in terms of we have been able to pinpoint on the map, so we know where we need to work on to contain cases. It is mostly, we're being updated on that map now with the actual positive cases. But in terms of, let me just tell the people of St. Martin, if you want to panic, the quarantined and isolated persons are all over the island. They're all over the island, and my map only shows me Dutch St. Martin, the southern side. So imagine the northern side. So we're looking at, from the time we shut down on the 22nd, so from about the 20th, or even earlier than that, we have looked at over 600 to 700 people already, and they're spread all over the island. People who returned home and did not adhere to the quarantine. These are the persons that have actually put us at risk. So right now with the contact tracing, those persons who are within the demographic of the last few who have gone to hospital, and it fits one demographic group which we have been able to pinpoint and are doing direct education, isolation, and testing on at the moment. So we're asking all those community groups who are aware of maybe persons who do not speak the language to get them the pamphlets, or, speak to them over the phone in their own language or via whichever medium that they are using to be able to educate this group of persons as well. We have gotten now that DCOM has arranged for a gentleman with the car with a loudspeaker to be able to go through these communities and speak to the residents in their own language. We're asking all who are within the sound of my voice, who are within these communities, to encourage persons, even though they live very close together, to remain as much as possible isolated and use proper hygiene. If you're sharing facilities such as bathrooms and toilets, always have your own cleaning materials to clean before and after use. The door handles, the doorknobs as well, the faucet handles, etc., to minimize your possibility of picking up any isolation. What CPS has done is in our mandatory isolation facility, we have taken persons such as those who are in large family settings or sharing facilities with many persons to avoid them spreading it. We are asking those persons to, we are having those persons go to our mandatory facility where they will be in a room by themselves, monitored by CPS, get food and medication and medical supervision.
So it's not a case of whether you want to come or not. You're actually taking you to the facility.
Yes. Before the state of emergency, we could have enforced, but we would have had to use police force and other laws. Now, within the state of emergency, once a person is a danger to themselves and the rest of the community, we can remove them if they do not voluntarily go.
The level of control at the borders, Madam Prime Minister, how is that going right now? Has it been upgraded?
Well, actually, the level of control was already ongoing. The challenge was that we had 4 border crossings to check. And now with our shutdown, the French and myself, we sat down and discussed together with our law enforcement agencies, the gendarmes and the police force of St. Martin. And we found that it would be better to only have 2 borders to do that full check at. So the Kupakoi point, crossing point, as well as the Oyster Pond crossing point, which are less traveled, and with our shutdowns, with our requests for quarantining and staying at home and only moving for emergencies, less movement anyway. But the Marigot, Bellevue, Colbay, and French Quarter, Dutch Quarter border crossings are much more used. We have medical and emergency personnel living and working on 2 sides. And so, of course, we want to facilitate that they can come as well as for emergencies. So, for instance, a person that, this has been ongoing since last week, Friday. So Friday gone made already a week that both forces were working together, checking on documents of persons passing. When it was just the French side, there were less, let's say, it was sporadic. It wasn't all day, so people could get through the net. Once the Dutch and French side were doing it together, of course, there was less. And once people know there are more checks, they will stay at home. Those who don't have to move for any urgent reasons, of course. We are not blocking anyone from making the necessary and urgent calls or moves back and forth, but at least this way we can restrict it now, especially with our lockdown in effect, to only emergency and urgent situations. So not because you like to go super U, you're going to be able to go at this moment because you like the products they give. You have to shop now. Once we release the restrictions for supermarkets, you will more than likely have to shop within your neighborhood as a first choice or the closest large market to you. And that we're looking at evaluating for this week. And within short, we will be announcing how that new measure will be going into place to allow for persons to shop. I'm meeting with the supermarkets today to be able to ensure that they can organize deliveries as well, so that persons who can order online will be able to do so. So we're taking all measures necessary, and for me, food security was one of the main things, and ESF 7 together with social services is working on assessing all who have filled in the form online as part of the social impact assessment to ensure that we meet the needs of all who require especially food and medication at this moment.
We've heard of people who actually collected checks pretty late, or probably even on Saturday, that didn't get a chance to even go to a bank to cash their checks to do their shopping. Do you plan on relaxing the order of the shutdown sometime next these people access to even opening a branch, one or two banks, to give them that opportunity to basically get some funds?
We understand that that may have been the case, and seeing the video of the gentleman, the security guard who was rightfully outing
Mm-hmm.
himself, even though
That too.
I must say he went a bit far. Threats can be punishable, so I'm warning the general public. Yes, you have freedom of speech, but you are not free to threaten people online. That is also a crime. What has been done to them, I would consider very negligent as well, and we are investigating that via our labor affairs. But any person who, at this moment, based on the fact that you just received your check, you can explain that on the form. That is part of the social impact, and I would encourage you to fill out that form online. It's on our government webpage. It's a social impact assessment form. And then where you have what particular needs you have as a result of the COVID-19 or the loss of economic activity, or you can put then that it is also maybe due to the fact that you were paid late or not paid at all on there. And then, of course, we will ensure that you get what is coming, what should be coming to you naturally through your employer, and we will deal with those cases as well. So if it is a labor issue, please ensure that you send that email also to dismissals at dismissal team. Let me repeat, dismissal team at stmartingov.org. And the form is on the form is online also on our government website, and it is a social impact assessment form.
Does this shutdown, basically this worldwide shutdown, in any way affect our students studying abroad, especially in the Netherlands?
Those schools that are able to carry on with their online studies, many of the schools just switched over to doing online, and so that's why some of the students decided to come home, even though I admonished them that they should not. Thank you, Peggy Ann. I have on my Prime Minister live feed, and Peggy Andros of Labor and Social and Labor Affairs just posted the form. So if you go on the live, you can see the form right under. Yes, thank you, Peggy Ann. Online services.stmartingov.org/COVID-19 SIA form.aspx. So you can go on government's website and find that form directly. And they even have some information in Spanish and in Patois. Thank you so much, Peggy Ann, for posting that so that I could share, and those that are following via the live stream can share as well. But I would like to ask people of St. Martin that every day new information is updated on our government webpage. So go to the page on a daily basis, twice a day. You don't have to stress yourself out to go all day, but at least twice a day. Go in the morning, go in the evening, or definitely go after 3 p.m. and you will have new information. I would really like persons to stay educated. You were asking, Grace, about the students. Just like our local students, many students are following now their studies online as much as possible. Those that would have had graduation ceremonies, of course, those have been postponed, etc. But majority of schools have kept some type of online programming going for the students all over the world.
Okay, all right. Now, let me ask this question, though. Will we be carrying out an assessment when all of this is basically not, I wouldn't say over, because it doesn't look like it's going to be over anytime soon, but the strain that will be on a lot of people here, the strain of job loss, the strain of staying indoors, how does this affect our mental health? Will we be doing an assessment on this,
Yes,
Prime Minister?
this is something that has been touching all over the world, and the WHO, if you go on the WHO website, for us as a small island, we know what we want to do, but for us, the most important right now is getting the information to all our demographic groups as well as our residents as to how they can get assistance. And online, we have that. The stimulus plan that the finance minister worked out with the Ministry of TIAC is being vetted with the CFT at the moment. I myself haven't had a chance. He sent it to me on Saturday, but I've been really too busy to actually go in depth into it. So hopefully today I get the opportunity to go in depth into that, to be able to answer some of these questions. But I will definitely I think he will be doing a press conference today to properly explain the stimulus plan. So you can look out for that. I really, for us at St. Martin, we have a APAP, the Association of Psychologists and I don't know exactly what the letters stand for, but it is Psychologists and Social Workers, an organization that was formed. I don't know if it's before or after hurricane, but definitely came into play after the hurricane. Each organization is looking like the government services, emergency services that are on the front lines right now are connecting with one or two psychologists to offer counseling online to their employees. Persons who already have a psychosocial therapist that they use are encouraged to contact them online via any contact numbers that they may have been providing. I know they have been reaching out to their clients. And so I know those persons who already were vulnerable are receiving the counseling, but the WHO has put out quite a couple of videos on how to stay sane in the lockdown. And I did post a little joke the other day, what the curtains say, on Facebook. Somebody sent it to me, and I said, hopefully I won't get bashed too hard for trying to lighten the stress of us staying at home, or those of you that have to stay at home. I'm still at home right now, but I have to go in because documents have to be signed, and other meetings I am not able to do from home. I have to do it via the video conferencing in the office. But I think, in lieu of, if you cannot connect right away with a professional, be as faithful as you can be and as spiritual. Connect to God or to whomever you serve. Connect to that higher spiritual omnipotence that is out there that can calm your fears. I have a book of my mom's that I found that says prayers through the storms, and it could be any storm you are facing. I am here looking for it because I had it last night. Prayers through the storm, many Bible verses have ways of calming you down. Call someone that you know has the ability to calm you down. Video conference or video chat. Use Skype, use WhatsApp video calling, use your FaceTime. We are not cutting off phones. Hopefully, if you do not have Wi-Fi, call, tell them, and find out how you can get Wi-Fi on the short notice. I know some people do it on their phones by topping up to some level. I'm not sure how to do that, but whatever you need to do to get online, the WHO site has several videos on exercises you can do in the home, what you can do with your children, ways to discuss the virus without being panicked. As a matter of fact, a lot of us in the Caribbean just like to, I can't talk about kid, buddy. I can't talk about kid. That thing's stressing me out. But it is actually the talking about it that actually calms your fears, especially if you can talk to someone with good knowledge about it. Build your immune system. Take your vitamins. I see a lot of people posting how they survived COVID-19. Those videos are good to watch. A lot of people are using the old folks remedies, the boiling, doing steaming, using whether it's eucalyptus leaves, ginger, lemon, lime, garlic, onion, all these things. I myself have had bronchitis in the past, and I had antibiotics for 3 periods, and it did not take away the rooting cough, because once that holds on to your lungs, it is very difficult to get it out if you have bronchitis or serious lung infections. And the only thing that got rid of that, honestly, was steaming, using eucalyptus oil or Vicks in hot water, and drinking hot ginger tea with lemon, honey, and cinnamon. And taking like medication on a spoon, the honey with cinnamon on there with lemon, make a little pot and take a spoonful 3 times a day, and that is what loosed up the phlegm and got it out of my system when antibiotics could not. So a lot of the things, the Vicks and stuff like that our people used when we were kids, that still works. And I'm hearing even from one of our own who lives in the United States, Raphael, that worked for him as well.
Yeah, I saw that yesterday.
Yes, so I'm encouraging the people of St. Martin to not be discouraged. We are a prayerful, we are a faithful, we are a loving community. And when you stop with the negativity and actually be positive, you will see how much better it will be. It is not an ideal situation, but we watched a month ago, 2 months ago, the people in Wuhan, China, being tied down, shut down for 3 months. And yes, people were allowed to go out street by street with masks on. Because I don't have masks to give everybody in the population, I cannot give you a mask to go out. I'm seeing people creating masks. Yesterday they said even a bandana around your face can help if you must go
Right.
out. It is just a matter of covering your own coughs and sneezes and your own breath. And then if the others are covering theirs as well, whatever they have won't jump on you. When you go back home, making sure you disrobe and you take a shower, wash your hands with soap, wash your face, wash all the way up to your elbows if you're not taking a full shower, and especially if you've come in contact with people. Leave your shoes at the door, and then you can touch your family, and then you can sit on your, people do not come from the outside and sit on your couch, sit on your chairs, or sit on your bed. Go straight to the
Right.
bathroom. I have hand sanitizer or alcohol and water that you can just squeeze onto a napkin and clean your hands as you walk inside. Wipe down your door handles. Take whatever you bring inside. Wipe down the outer parts of that before you start to actually take out whatever you've brought from outside. I know people who even wipe down all the groceries before they put them away. People might say, oh, you're going too far, but being a germaphobe in this time is going to save your life. Do not hug and touch
Definitely.
your family who has been in the house and safe all day with yourself that has been outside without bathing, washing, and changing your clothes. These are just simple things that you can do to stay safe, especially for those first responders, especially for those frontliners who have to go out and work. Even though you put on PPEs to deal with the sick, totally disrobe. And this was something over 20 years ago, a friend of mine told me that because children are so germsy, and she had to do those things because I do not want to infect my child with whatever I may have picked up at school.
Does it the